of how to take your CHNA and make it actionable for your hospital and your community. So Stratasan's conducted about 15 CHNAs over the last 3 years, and I'm the lead advisor on our CHNA. So what are the required components of a CHNA? So what's interesting is some hospitals have been doing community health needs assessment for years as a part of their community benefit efforts. However, as a part of the Accountable Care Act, CHNAs became a requirement for not-for-profit hospitals that are 501c3 designated hospitals. So the final rules were released on New Year's Eve 2014, although the requirement began in March of 2012. So those folks at the IRS really know how to party, putting out final rules on New Year's Eve. So each not-for-profit hospital completes an IRS Form 990 annually, and the CHNA requirements are on Schedule H of that form. So you can download this form off of the internet. That's where I got this picture. I know you can't see it, but just download it as a PDF. And it tells you all of the different requirements for a CHNA. Now, it tells a hospital what to do, but not really how to do it. And there's considerable leeway in how to implement the requirements. So the steps are fairly straightforward. First, you must define your service area or the community you're trying to assess and impact. So we look at the patient origin of the hospital and define the CHNA service area by county. That's because most public health data is available only at the county level, but we look at a lower level, and I'll show you some examples of that later. So you must assess the needs of the community every 3 years. Again, the IRS doesn't tell us how, just that we need to do it. Thirdly, you must solicit and take into account input from the community and public health. Fourth, the CHNA must be available in a written report approved by the board and available readily to the public. So the final rules gave a little more definition into input, articulating that the public health department must be involved. Medically underserved, low-income, and minority populations should also have input. The final rules also focused more on documenting your previous CHNA progress and what progress has been made since the last one. The ACA also requires that the health needs of the community be prioritized. So once the assessment's finished, the hospital needs to create an implementation plan, and the plan needs to specifically address the needs identified in the assessment. But this is really important. The hospital doesn't have to meet all of the needs, but be prepared to articulate why some of the needs are not being addressed, and usually the needs aren't being addressed due to expertise or lack of resources or lack of people and money. John's going to show you an example of a hospital that selected diabetes as one of their implementation ideas. Well, that's a great one for a hospital because hospitals usually have experience and expertise in diabetes education. If one of the top initiatives is a better school lunch program, maybe the hospital won't have as much expertise in that area, and we'll leave that to another member of the organization, of the community. So on the next slide, this is my open letter to CEOs. It's from Stratasan, but really it's from me. Given that we've worked on so many CHNAs over the last 3 years, I have some insight as to the level of commitment of hospitals, and some are very committed to the community health improvement, their role in that improvement, and what it means strategically to the organization to perform a CHNA and improve health. Others, however, assign the CHNA to an individual in the organization who has no idea the strategic importance or relevance the CHNA has to the organization. So please don't check the box. The Form 990 has a lot of boxes that need to be checked. But don't expend the resources to complete a CHNA just to meet the requirement. If you're going to go to the trouble to assess the health of the community, involve community members, create an implementation plan, by all means use it strategically to advance the hospital in the eyes of the community and to actually improve health in your community. So after John shows you what's possible as a result of a CHNA, you'll not want to just check the box, I promise. So I'm going to briefly review the Stratasan CHNA process. We use five stages for our CHNAs. I'm going to share these with you. They're very common sense approaches to the CHNA while linking your community health needs assessment to the hospital's overall strategy. So you may have performed a CHNA internally, or you may have used an advisor, a partner, or a consultant. The reason hospitals have hired us is because CHNAs are a lot of work, concentrated into a very short time period, and are sporadic every 3 years. So most hospitals don't have internal resources to focus on such a project. And in my opinion, if a hospital is going to add resources for the CHNA requirement, add it to the implementation portion, not the assessment portion. It's easy enough to get help from Stratasan or some other organization for the assessment portion or metrics creation, and you focus on the implementation. If you need more help, there are organizations that focus on just the metrics or just the implementation. So Stratasan Stage 1 is a market research analysis. This is where Stratasan's process will be different from most other advisors. We begin with a hospital-focused analysis of the market. So this is the kind of analysis that you do prior to any strategic planning process. So this is definitely optional as far as meeting the requirements of the CHNA, but at Stratasan, we're health planners and believe that the CHNA should be an integral part of the hospital's strategic plan, not something separate and apart. So we geocode the hospital's patients to a rooftop address level, and we use that patient information to justify the CHNA service area. We also use it to identify disease hotspots. We use state data, if available, to calculate utilization and market share. We look at market share by zip code and by service lines. We analyze psychographics and demographics, a lot of the things, as I mentioned, that you do in your regular strategic planning process. But we also use that information for the CHNA. But it's very hospital-focused as opposed to community-focused, but it links the two together. So our Stage 2 is what you typically think of as a traditional CHNA. First, we define the service area for the analysis and the implementation effort. We dig into all the secondary data available to determine the health needs and the key determinants of health. We analyze the socioeconomics and demographics of the area. Now, public health data is great for this type of analysis. And it's unfortunate, but many hospitals and public health departments don't really know each other because their paths don't cross on a regular basis. In the CHNA, the hospital and public health department work hand in hand with each other. We look at healthcare access issues, disease hotspots, evaluation of medically underserved, low-income, and minority populations. This is the stage where we identify key stakeholders and conduct interviews or focus groups to gain the required community input. This stage is also where we generate the asset inventory to document all other healthcare and nonprofit groups in the community, which are assets to the community when trying to improve health. This stage also evaluates the impact of actions that were taken since the previous CHNA. So do you see what I mean about this being resource and time intensive and many hospitals not having the resources? So the next couple of slides show some examples of the assessment data collection. So these two maps show median and low income by block group. So remember I talked about how a lot of the secondary data is only available at the county level. Well, when you look at some of the socioeconomic and demographic and some other data, you can look below the county and zip code level to block group. Also, it's really important to use great visualizations because a lot of the people involved in the CHNA are lay people. They're not healthcare people. And they need to understand the data so that they can improve and have an impact on the health of the community. So we also look at health indicators on a map level, such as smoking. We also look at prescription medication utilization, such as high blood pressure or diabetes medication. And we also look at crime statistics on maps. We also use readily available public data such as county health rankings. So just go to County Health Rankings website And what we do is we like to look at our county and the surrounding counties and put it into an Excel table and use some conditional formatting so you can see where your county falls out on the measures and the rankings for the other counties. And the next slide is another example of using a county health ranking to look at your county's health. It's really easy to explain. You're looking at your health outcomes, your health factors. You can actually just write on this slide where you rank and what your measures are for each of these indicators. So stage 3 of the Stratasan CHNA process is to receive more community input through a telephone survey. So remember, we did either focus groups or interviews in stage 2, but this is really getting more community input. We've looked at about 400 telephone surveys for the CHNAs that we've done. It varies a little by community. And we also do online surveys for hospital employees and physicians because they're also members of the community. And I recommend here, if you're going to ask folks on the phone about community health issues, you may as well add some hospital image or utilization questions. Again, integrating the CHNA with the strategic plan. Because actually a telephone survey is not required for a CHNA, it just says you need community input. So if you are going to go to the time and the expense, ask about more than community health. Stage 4 is community input and engagement. So this stage is the most fun and productive part of the CHNA. So this stage is really a continuation of the interviews conducted in stage 2. We're getting input, more input from the community. You can see examples here of the people you would invite to what we call a community health summit. We also recommend having a leadership forum, which is a smaller group of community leaders, just really asking for their support prior to the summit. This leadership, the Community Health Summit, lasts about 4 hours. We've done, like I said, about 15 of these. Here are some examples of our summits. They're so fun. It's about 4 hours, brings together many members of the community. Our smallest summit's been about 35 in a small rural community. I think we had about 150 in a larger community. And the first 2 hours of the summit is building the common database of knowledge. That's where the State Department of Health talks about state health initiatives. The local health department may speak about local health initiatives. And then Stratasan or the hospital would share your research, your interviews, the secondary data collection. But the second half of the summit is the community prioritizing those health issues and brainstorming possible solutions to the top issues. So it really lets the community have a lot of input into what the hospital is going to work on. But the hospital ultimately gets to select. So the CHNA is a strategic planning tool. For those of you who have been through and involved in the strategic planning process, you probably already recognize the similarities in the process and the information. Oh, I skipped my final. I jumped ahead. Let me go to the final report. The final report is about a 25-page report. It's got lots of community photos. It summarizes the process, the assessment, the summit. The hospital adds their implementation plan, and the result is a very visually pleasing, pretty PDF that you can print and is also available for posting on the hospital's website. So now I can jump into the CHNA as a strategic planning tool. You've noticed that they're pretty similar. You're doing an assessment, you're creating an implementation plan, you're prioritizing. But let me talk about some of the other things you need to look for in a CHNA that can help you with your strategy. If you're going to interview community members or whole focus groups, you're going to hear issues and suggestions for healthcare beyond your community health improvement. You'll hear things such as customer service in your hospital, quality, access. You'll even hear things about signage for your hospital. Don't ignore this information just because it isn't related to community health. So this relates to checking the box versus a strategic process to improve both the community and the hospital service. Another thing that's beneficial in the CHNA to the overall strategy is product line development. Determine the health needs of the community is key to product line development. You have to make sure there's a market for the product lines you're offering. If you're thinking about offering a new product, you need to know if there's a demand. because you're going to spend money on physicians, equipment, staff, buildings, and you need to ensure there's demand and you can use the CHNA for that. Relationship building with the community is essential for a hospital, and the CHNA process does this. We've received such positive feedback from the CHNA process solely based on the relationship building parts of our CHNA. As I mentioned earlier, a community survey can be expanded with access and image questions. And the implementation plan of a CHNA should be a strategy within the facility's strategic plan. So it's not a standalone process. So ideally, it'd be beneficial to coordinate the CHNA and the strategic plan together so that you can use the data from one for the other. So on the next slide, many hospitals use Baldrige criteria to guide their planning and quality. We worked with a hospital that did win the Baldrige Award. And there's a category in the Baldrige criteria of customer, which includes the voice of the customer and customer engagement. And the CHNA process specifically has those as explicit goals to include community and customer input. Most hospitals have a customer relationship strategy of some sort, as well as customer engagement as a strategy in their action plans. On the next slide, a lot of hospitals have a population health strategy. Well, the CHNA is an integral part of knowing the health of your community and your population. Population health outcomes are the product of multiple determinants of health, including medical care, public health, genetics, behaviors, social factors, and environmental factors. All of these, besides genetics, are included in the CHNA. So the next slide is an example of a strategy within a CHNA. So the goal is to improve prevention, detection, and treatment for all persons who have or are at risk for obesity, diabetes, or heart disease. It's a pretty common goal of a CHNA. But this slide shows the population impact, the strategic priorities to achieve the goal, and the desired outcome you can measure over time to see if you're making any difference. And you'll notice that this coordinates great with the actual implementation that John's going to show you of a health system and how they took their strategies and put them into action. So some investor-owned hospitals are performing CHNAs. We've worked with about 3 investor-owned hospitals. Now, why would they would be a question, because they aren't required to. And I think it's because politically and socially adept hospitals are performing CHNA because it does all the things mentioned in the previous slides. It assists with product line development, it improves community relationships and bonding, and it helps with the population health strategy. So it just makes sense whether you're a not-for-profit or a for-profit. Now, John is going to walk you through a case study of a hospital wellness strategy born of a CHNA that takes us from inside the hospital to outside in the community. John?
Yeah, thanks, Leanne. Leanne has discussed the requirements in the process, and as she set me up, I'd like to share the benefits of an inside-out approach and how one of our clients from Ten Adams has successfully brought their CHNA implementation strategy to life. So, as it was discussed that the CHNA is really looking at the outside needs of the community, and that's what's required. But here's an example of how a hospital used the CHNA beyond just what was intended and looking at the benefits, including employees, in our implementation plan. And we need to, because the issue with compliance of preventative measures with our own employees is consistently lower. There's a higher percentage of chronic conditions, which ultimately leads to a higher burden of illness and costs. Bottom line is healthcare workers are great at taking care of their patients, but not always of themselves. The effort within our organizations will help with reduced absenteeism and increased productivity, and we've seen a boost in morale, which leads to reduced healthcare costs. All of these benefits not only contribute to healthier employers, but to healthier organizations, and all of this is a good thing. So there's 4 key themes that I want to share. That's how do you approach this by being a leader, being prepared, be smart, and be accountable. Let's look at being a leader. In addition to the CHNA requirements from the government, a few years back, the American Hospital Association issued a bold call to action for hospitals and healthcare systems to create a culture of health, to serve as a role model for health for a community by creating a culture of healthy living, and working to provide a variety of programs focused on both positive and some negative incentives by tracking participation and outcomes that all help to measure ROI and really focus on sustainability. So that bold call to action combined with the requirement for CHNAs gives us an opportunity to respond. And we start by doing that with our own staff and employees. And so what's the best way to accomplish this? Well, we can do that by looking at my second B and being prepared. I know that we all have significant lists of initiatives and projects that are focused on and go way beyond just a CHNA project. And because of timing and deadline pressures, we might be inclined to jump straight to tactics and getting stuff developed so we can report to our peers and executives that we're making progress, and to be able to show some examples of those progress. However, I would caution you to not jump too quickly into the work until you have a solid strategy or plan in place. And I would also expect that most every hospital is doing wellness in some shape or form. But my experience tells me that the initiatives that are taking place are probably very siloed, and not everyone knows what's being offered or how to take advantage of the services that are already in place. So when it comes time to your wellness initiatives, take a good look at what you currently offer and to whom. Get a clear understanding of your current state. And I'll talk a little bit later about doing a wellness inventory. So understanding your current state is important, but more importantly, understanding where you want to go in your desired state. It's so critical within our organizations that we are clear on what we are all working towards, and we're all using energy to support and work together, moving in the same direction, aligning our efforts, and moving in the same direction is much easier when we're all clear on where we're going. And where we're going is set from the top with a vision. So creating a wellness vision should be directed by leadership. But as many of you know and have experienced, sometimes executive leaders in healthcare, they look to marketing to help address operational challenges. So you're probably a pro at that. But regardless of who and how this gets developed, a solid wellness vision needs to include the values that help drive the wellness programs and define goals and objectives. So these wellness programs must, and I emphasize again, you really need to have CEO leadership and support to really achieve the greatest levels of success. Build wellness teams, have a data collection component in place, and incorporate these initiatives into a wellness operating plan that is then supported with the appropriate level of interventions and to help really create a supportive culture and environment. And of course, that data collection and measurement gives us the opportunity to evaluate outcomes of the programs. So with that vision set, there's also a number of critical success factors that should be incorporated. It's key to align all your initiatives with your organization's mission. And you need to look at all employees, not just those high-risk employees. It always is beneficial to offer some incentives and include the employee's family and you may have the best wellness program, but if it's not effectively communicated, you're not going to have the success that you deserve. So be sure to have a clear understanding on how to really promote the content and communicate it within your organization. Keep the programs current and really look at evaluating, collect and gather the data, be prepared to make some adjustments, and showcase positive results. In my experience, there are always positive results, and showcasing those can have a big impact. Well, once you thoroughly have been through the preparation and planning process and have your vision, objectives, and development and goals in place, it's time to be smart and roll this out and really build excitement. So the client story I'd like to share with you is about Tanner Health System. Tanner is a 3-hospital system located in Georgia. They serve a population of about 150,000 residents and have about 2,800 employees. As most of you know, hospitals are typically one of the largest employers in their market. So this is a great opportunity to really connect and leverage those relationships. So as Tanner went through their CHNA process, here are the top-level results. It was identified that there was a lack of access of medical care services to a significant portion of their area, which is a problem, and a problem that's an increasing magnitude to those living in rural communities. Social determinants are strongly correlated with any number of lifestyle and behavior choices, such as smoking, exercise, and diet. Probably no surprise that obesity and the prevalence of that reached epidemic proportions nationwide. And in the United States, unfortunately, it's still rising. The prevalence of diabetes is increasing both in Georgia and in the United States at an alarming rate. And while death rates and incidence of cancers have been declining due to advances in research, detection, and treatment, cancer still remains a leading cause of death in the United States. And then one of the other results that was identified was mental health. We all know that easy solution for a growing challenge in our country. So we have partnered with the Tanner Strategy and Marketing team. We took their CHNA results and identified what areas could be best addressed from a marketing and communications perspective. What could we have most impact on? And we helped to identify the prevention and reduction of tobacco use and obesity. We knew we could have an impact on ways to increase physical activity, improve nutrition. We wanted to communicate how we could increase to demand for high impact quality preventative services with the goal of improving the community environment just to better support health. Well, even after we narrowed down these results, there was still a lot of information that needed to be shared with the public. And we always look for ways to simplify the message as much as we can. So we developed a creative strategy to develop these key messages that would transcend both internal and external audiences. So as we developed this creative strategy, we created the following messages focused on their results of their community health needs assessment. And the first one was be well, eat healthy, and get fit. And then we aligned the key components and even more specific programs that Tanner had developed from their implementation strategy for each of these messages. So this is how we aligned the programs under Be Well that was focused on prevention and reduction of the tobacco use, diabetes education, prevention and management. There's an emphasis with the Childhood Obesity Task Force and healthy child care centers, and just overall focus on safe and healthy communities. So that was our focus of Be Well. Eat Healthy, as you might imagine, was focused on nutrition. They had been instrumental in developing a regional food systems collaborative and cooking matters series, along with connection with farmers markets and local food and restaurant challenges that they helped to spur community gardens and also nutrition training in schools. Under the focus of Get Fit, with our objective of increasing physical activity, there were weight loss challenges and healthy life classes, along with group exercise and youth wellness classes. There was a faith-based initiative to really tap into the power of those organizations, along with business and industry and their school program, Take 10. So building upon their community-facing initiatives, we also explored how to best leverage and connect the messages with their employees from an internal perspective. So how do we do that? How do you communicate this not only to the public, well, that's by leading by example. For years, Tanner had access to multiple walking trails on or near their campuses, but not until we packaged a program to really give employees a tangible product to connect with did they really begin to get some traction. So through a grant, Tanner was able to provide fitness trackers to most of their employees, and with this technology, then they could then measure and track the results. They developed various contests and competitions focused on things like the highest average daily steps and the most active daily minutes. Well, here's a photo of one of the contest kickoffs. And remember when I said wellness must be supported from leadership? Well, please notice the guy in the middle of this group. That's Tanner CEO Loy Howard. He's involved and very supportive. He has shared how over the past 5 years, and this is a long-term initiative, they've been focused on changing the way their employees engage with their personal health. And their wellness programs have gone a long way toward helping Tanner achieve not only a healthier overall workforce, but being a model in the community for health. So interest in employee wellness continues to increase, and it's connected to these community wellness programs. Having a friendly competition with prizes, that's always a good thing and never hurts. With some of the results that they've accomplished, 192,000 miles collectively they have walked. That's like walking across the United States 68 times. Their Well for Life program is not slowing down. There's another Fitbit challenge for their organization's employees already underway. So lots of great things taking place internally, and we wanted to maximize how we continue with this same message, same initiatives, same energy that's putting into the internal and externally. So Tanner has done a great job connecting both their internal and external communities by focusing on wellness. So let's focus on how we connected these messages with the organization's overall brand positioning. Ten Adams has looked at their entire brand with a vision, with their goal at a brand level of advancing health. We're also looking at ways to promote the brand through their service lines. And one of the significant initiatives that was a key service line promotion was wellness. In addition to that, there was very targeted messaging that was defined around disease and condition marketing, and then some grassroots efforts to really connect with the community in some very new and innovative ways. So when it came time to launch the program focused around mass advertising, we knew we needed one location to drive all audiences to learn more about the details. And those audiences were both internal and external audiences. So to address that need, we developed a campaign microsite, gethealthylivewell.org. This became a key call to action that all of the mass advertising was directing people to learn about the three areas of Be Well, Eat Healthy, Get Fit, all the upcoming events, and it was a great way to put all of the information in one easy, friendly user experience. There was print ads that were developed promoting the key messages around smoking cessation and the emphasis on Get Healthy, Live Well. There was an emphasis on promotion of servings of fruits and vegetables of Go for 5, and Know Your 5, focused around the knowing your numbers and how that could save your life. Lastly, we had an outdoor execution focused for healthy moms and babies, all just creating a significant awareness of Get Healthy, Live Well around their community with some very simple key messages that all supported the elements that were identified in the community health needs assessment. So working with others, community and their employees, Tanner created an impressive list of programs and educational tactics to really help bring that implementation strategy to life. Focused around tobacco, diabetes. They launched this diabetes prevention program that initially had 70 participants. Those folks lost a total of 529 pounds. 70% achieved measurable improvement. So you can see throughout this process, not only are they implementing lots of great things, but they are designed in a way that results are able to be measured. And this is key for their ability to track and show progress. Around Eat Healthier and improving nutrition, they had their classes to provide nutrition and educate around cooking. And that was led by 46 volunteer instructors that were all a part of the organization or the community. They found monthly cooking tips and introduce the SNAP benefits into their community. They were key in developing partnerships for regional food systems collaborative that included farmers and businesses and restaurant owners and chefs and school nutrition directors, and supported with master gardeners. And they partnered with Home Depot, where they helped to build beds for their gardens. And these community gardens had a broader reach than just traditional community gardens, because they helped provide food for needy families in food pantries. So the hospital was also able to broaden the reach. This is more than just initiatives driven by the hospital. They needed the support of the community and other organizations. So they aligned with garden clubs and 4-H groups and others to really help with the implementation of many of these initiatives. Around Get Fit and their weight loss challenge, there was initiative focused healthy on and weight off challenges where folks developed their exercise and kept food diaries so that they could track and calculate their progress. So very impressive elements that took place around these challenges that had great results. The results of losing almost 2,400 pounds between 233 participants in their first challenges. And they really got local businesses involved to help provide some financial support, but more importantly, they touched over 500 people as they provided exercise and nutrition classes. Another great program that was underway that needed to be promoted was their Take 10 program, which was designed to add an additional 30 minutes of physical activity to the full day of their area students in their community. They trained 148 first grade teachers and guided them and helped them understand how they could get 10 minutes of bursts of activity incorporated throughout their day. And then folks from Tanner designed a play about nutrition, and they took that out to the different schools, reaching over 4,000 students. So that is the story of Tanner and how they really brought their implementation strategy to life internally and externally. And one of the things I referenced earlier is between your current desired state was to do a wellness inventory. And again, I'm sure most of you are doing wellness in some shape or form. So do an inventory so you know what initiatives are currently underway or being planned. Do you need to talk with cardiac rehab to find out what kind of heart disease education that they're doing with existing patients? And then how can you leverage that work beyond heart patients into your own employee population? It goes beyond heart. That includes all the elements that are so well known under these community health needs assessments around diabetes, obesity, smoking cessation, around screenings and stress management, and healthy focused on weight management and fitness. Creating this master wellness inventory along with departments and directors and helping to identify who is responsible for the development and delivery of these existing programs will be key. Evaluate the list and determine if there's any missing pieces to your wellness puzzle. Or if you have all the parts, chances are they're probably just siloed. With some focus and some commitment, you can better align all of these separate initiatives into a more cohesive and collaborative program. I hope that the Tanner example helped to demonstrate that. So accountability is key in healthcare today. And while I shared many of the results that Tanner has achieved, I also wanted to share some more results from a national health system that had a focus on internal wellness initiative across 385 of their hospitals, incorporating more than 150,000 employees. And as you look at participant profile at a very large level, I expect that their issues and needs are pretty consistent, whether it's a large organization or a small organization. So utilizing data from screenings and health risk assessments, you can help to classify your employee population, whether it be low, rising, or high risk. And with the help of targeted communication and appropriate levels of care intervention, you can have a significant impact. And depending on the results of your health assessment, there's going to be a couple of different paths that you can guide the participants down. Those that are at a level of rising or high risk, they probably need to be provided a more focused and preventative measures. Those that are a lower risk, they might just want to get involved with some preventative maintenance. So health coaching is key. I know when Tanner made commitment to health coaching, they saw their results increase significantly. And there's lots of ways to measure, but the key is to measure. And when you measure, you can share results like these. 1.34 return to every dollar invested. And they're making a positive impact with their employees, their community, and their organizations. And I know with a focused effort and a renewed effort, I'm sure you can too. Well, I want to thank you all for joining us today. Our next webinar is going to be on August 12th, focused on bridging the gap between your strategic plan and marketing execution. So, Leanne, what kind of questions do we have that may have been asked while we were giving our presentation?
All right, John, what grant did Tanner receive to supply their employees with the fitness trackers?
Yes, Tanner received a community transformation grant from the CDC in September of 2012. Was their first grant. I think the exciting thing about Tanner really is their leadership, the organization's leadership. They really have no limit to their thinking. They think big, and that empowers them. And this was the key to this organization securing some pretty big dollars to make a significant impact in their community. Because they made an impact, because they were able to track results, that set them up for an additional grant from the Department of Health and Human Services that was awarded then about 2 years later, that is a 3-year grant. So those dollars are out there. They may not always be significant, but by putting the processes in place to really show progress and show measurement, there are dollars available.
Wow. They're a great example of not just doing your CHNA and letting it just meet a requirement, but actually implementing to improve not only their community, but their hospital. And how many staff do they have to maintain their program?
Well, with the, let's see, they were able to add 2 people to their staff after the first grant to really help to implement, coordinate, and track. And while people are key and having people on staff, it was really their employees and their commitment and the commitment to get healthy and live well and how that was communicated and really integrated into the culture that really made those 2 people be so impactful. So. Oh yeah,
because that's a lot of work for 2 people.
Yeah. It is, and it's not just those 2, but
yeah, I'm sure. This one would be for me. How does a hospital decide which priority health issues to work on and include in the implementation plan? And it's a great question because you may have, your community may prioritize upwards of 10 community health issues. And so the hospital's got to decide, gosh, which of these 10 do we focus on? And I think it's a process of matching the hospital's strengths with the top priority issues. I mentioned earlier that diabetes is a high priority issue for most communities. Hospitals are great at diabetes, so that would be one that the hospital could easily take on. Whereas improving school lunches may be one that the hospital says, we don't know as much about that, we'll let somebody else take that one. So I would say look at your health system and hospital strength, match that to the highest priority issues. So that's it. If you have any more questions, we have some contact information on the next slide. If you need any additional information or have more questions, there's our contact information. And thanks for attending.